But there is something changing, and it really gets at the heart of the physician-patient relationship. In my role, I was always asked, you know, what makes an outstanding physician? And really, at the heart of it, in my mind, is the person's interpersonal skills. You know, the ability, if Susan were my patient, the ability to go in a room with someone alone, close the door, and within just a few minutes, just in your style of conversation, you begin to make a relationship with that patient that forms the basis of the physician-patient relationship, trust. And it's based on, right, the physician having knowledge, got to be smart, right? The physician has to keep the things the patient tells them private, right? And then they have to have the patient's best interest at heart, not the hospital, not the insurance company, but the patient's best interest at heart. And you know, you don't do that as a physician by going in with the patient and saying, you know, I'm really smart, I won't tell anybody what you say, you know, I only have your best interest at heart. You do that by the way you communicate and the way you touch the patient when you examine them. Here's what's changed. Now, if Susan and I have an office visit and we make a decision about the next step in therapy, it's almost as if there's a creepy third person in the room. Because as soon as we get out of the room, someone's trying to change what we just decided. Last night, a provider told us they see 12 patients a day, and the next day, they get 12 faxes or 12 communications, or somehow someone's trying to unspool what they did with their patient yesterday, either trying to substitute a drug, right, switch to, within a therapeutic class, switch to a completely different agent. And so that creepy third person in the room really gets at the heart of the physician-patient relationship. So that's why when Fritz said, right, if the physician and the patient decide something, dispense is written, yes, right? Because it's more than just selecting the therapeutic agent, it's at the heart of the relationship.